The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. My name is Ann Potempa. Welcome to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. This webinar series was created to provide a way for us to talk about our projects and explore ways we can work together. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. Please do not put this call on hold. If you receive a call, please hang up and then call back in later. The webinar is planned for 30 minutes, 20-minute presentation followed by 10 minutes of questions and answers. A recording of today's webinar will be sent to all participants, and the slides will be made available online. Next slide, please. Audio for this webinar will come through your computer or the telephone. If you have technical difficulties, please let us know by sending us a message through the questions box. Please hold your questions until the end of the presentation if possible. To ask a question, you can type it in the question box. You can also raise your hand by clicking on the hand button, and then we can unmute you and let you know that it's time to ask your question. With that, I'm going to send this over to Mary, who will be giving our presentation today on the Diabetes Prevention Program. Thank you, Mary. Mary, you are muted.
Thanks, Ann.
Yep. Why don't you start again?
All right. Hello, everyone. My name is Mary Schneider. I am the Diabetes Prevention and Control Program Manager at the state of Alaska. I've been in my role for a little over 2 years now. Before that, I'm originally from Chicago. I moved to Alaska about 8 years ago. I moved to Dillingham, Alaska, where I worked for the Bristol Bay Area Health Corporation, doing environmental health work with the tribes. And then I moved to ANTHC, Alaska Native Tribal Health Consortium, doing environmental health there for a couple of years. And like I said, I've been here with the state managing the Diabetes Prevention and Control Program for about 2 years. So today I'm going to focus on the National Diabetes Prevention Programs that we have available in Alaska. But before I really get into it, I really just wanted to show brief data. We're not going to get too heavy into the data, but when you look at this graph here, you can see that diabetes prevalence has been increasing in Alaska and nationally for decades now. So that yellow line represents diabetes rates in Alaska, and the blue line is nationally. So you can see these numbers have been increasing as far back as we have data from the 1990s. And so many people with diabetes, about 95% of those with diabetes have type 2 diabetes, which and oftentimes can be prevented or delayed. Before they don't just wake up one day though and have type 2 diabetes. Many people start off with prediabetes, which is when your blood sugar levels are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. So if people can catch it while they still are in the pre-diabetic range, they can try to do some work to prevent the development of type 2. Prediabetes increases your risk of developing type 2 diabetes, as well as heart disease and stroke. But the biggest concern is many adults at risk for prediabetes. Many adults are at risk for prediabetes, but they don't know it. The CDC estimates that 1 in 3 adults in America have prediabetes, but 8 out of 10 of them don't know it. And this is for various reasons. They haven't been screened by their doctor. They don't know that they're at risk. And so we really want to focus on prevention so that we can start to see that trend of diabetes go down over time. So the CDC saw this data and they realized this is a big problem. You know, people with diabetes spend a lot of money on healthcare. They have a lot. This is a chronic condition that has to be managed daily. So they wanted to see what can we do to prevent diabetes from occurring. And that there's this drug called Metformin that's commonly prescribed to people at risk of developing type 2 diabetes. But they thought that there might be something to having more, there might be something to improving diet and exercise to prevent or delay onset of type 2 diabetes. So they developed this big study. It was supported by the National Institutes of Health. It was a long study spanning over 5 years with over 3,000 participants from 27 different clinics around the country. And what they were really trying to answer in this study is taking metformin more effective than diet and exercise to prevent or delay onset of type 2 diabetes? So they took all of these participants, over 3,000 people, and split them up into 3 different groups: the Metformin group, the placebo group, and the lifestyle intervention group. So the Metformin group, again, this is a drug commonly prescribed to people at risk of developing type 2 diabetes. The Metformin group was asked to take 850 milligrams of metformin twice a day, and they were provided standard advice about nutrition and physical activity, just, one-on-one at their doctor's office, maybe spending 10 minutes talking about it. And then there was a placebo group. So a placebo is a pill that is prescribed that really doesn't do anything. It has no active ingredients. So this group took a placebo drug twice a day, and they were given that same standard advice about nutrition and physical activity. Whereas the lifestyle intervention group, they were asked to achieve a 7% weight loss and maintain that weight loss over time, and asked to increase their physical activity to at least 150 minutes of moderate physical activity per week. This group was really based on developing goals to change their behaviors. Participants were paired with lifestyle coaches that provided training in nutrition, physical activity, and behavior modification. So they had that support in developing and achieving these goals. It was a year-long program. In the first 6 months of the program, they were delivered a core curriculum of material that went over the things related to nutrition and physical activity and behavior modification, and this was delivered in group sessions with other participants. In the second half of the program, or the second 6 months, they continued either one-on-one with their lifestyle coach or in group sessions to support the maintenance of these lifestyle interventions that they developed in the first 6 months of the program. And what the study results found was that those that were participated in the lifestyle intervention group were 58%, they had a 58% reduction in developing type 2 diabetes over a 3-year time compared to the group that took a placebo pill. Metformin was still more effective than those that were on the placebo at 31%, but those in the diet and exercise group, or the lifestyle intervention group, reduced their chance in more than half of developing type 2 diabetes. So they said, yes, getting this intense lifestyle intervention education through this type of program was very effective in reducing type 2 diabetes. So the CDC said, the evidence shows that this works, so they went and developed the National Diabetes Prevention Program. And it was really framed very similar to the study that was done. This program is for people with prediabetes, so it's really focused on prevention. People with type 1 or type 2 diabetes are really not eligible for this type of program. It is a year-long program led by a trained lifestyle coach, just like in the study, and that uses a CDC-approved curriculum to teach participants to make better food choices, increase their physical activity, improve their coping skills, and set personal, realistic goals. To be eligible for the National Diabetes Prevention Program, you have to be at least 18 years or older, so it's only for adults. You have to have a body mass index, or BMI, of 25 or greater. For Asian Americans, the threshold's a little lower at 23. You cannot have a diagnosis of type 1 or type 2 diabetes, because again, this program is really focused on prevention. And you have to either have a recent blood test indicating that your blood sugar levels are in that prediabetes range, or you can score positively on the screening, the CDC's prediabetes risk test, which is, you'll see on the right side of your screen, is what the prediabetes risk test looks like. It's 7 simple questions that ask you things like how old you are you a male or female? If you're a woman, have you ever had gestational diabetes? Do you have anyone in your immediate family that's been diagnosed with diabetes? Have you ever been diagnosed with high blood pressure? Are you physically active? And what is your weight category? So 7 simple questions that anybody should know about their personal health history and can easily answer in maybe less than a minute. So those that score 5 or higher on that risk test are automatically eligible for the National Diabetes Prevention Program. They don't have to have a blood test to confirm. So we do have some national diabetes prevention programs available in Alaska, and here's a list of all the programs that are out there. There's a couple in Anchorage at the Anchorage Neighborhood Health Center and the YMCA of Alaska. Fairbanks, there's one at Tanana Chiefs Conference and the UAF Cooperative Extension Service. UAF is also trying to get one started up in Palmer. There's one available at Bartlett Regional Hospital in Juneau. There's one through the Kenaitze Indian Tribe in Kenai and the Ketchikan Indian community. So you'll notice a lot of these say their delivery method is in person. And over the last year with COVID, obviously in person was not very safe. So a lot of them pivoted and have been delivering their programs over an online platform like Zoom. Some of them are starting to slowly go back to in-person. It really varies between program, but there are safe options to participate in these in-person programs during COVID. And then I have those 2 at the bottom there that I'm really going to focus on today, Inquisit Health and Omada Health. Both of these programs are available statewide. So I know we likely have participants on this webinar from all over the state. So these 2 will apply to anybody. You don't have to live in that community to participate. Inquisit Health is available over the phone, so anybody with a cell phone or a landline can participate, whereas Omada Health is available online through either your computer or a smartphone using an app. So I'll go into a little more detail about each of those 2 programs. Inquisit Health, again, this one's delivered over the phone. It's free for all eligible Alaska adults. They're paired up with a mentor who delivers the program over the phone through regular one-on-one calls. Participants receive a free wireless scale so that they can use that to track their weight throughout the course of the program. And to determine whether or not you're eligible, there's 2 different ways you can see. You can either text the word health to 600-400, or you can contact our partner Leslie Shellcross at the UAF Cooperative Extension Service. I've included her phone number and her email address there. And Leslie would just kind of walk you through some of those eligibility questions to determine whether or not you are eligible for the program. So once you either text that health to 600-400 or contact Leslie, you'll receive a call from Inquisit Health to complete the registration process. And they'll ask you for your address so that they can mail you a program booklet and a wireless scale. And they'll pair you with a mentor who will then get a hold of you to schedule regular calls. For the first 6 months of the program, these are weekly calls, and then they move to about monthly for the second 6 months of the program. The cool thing about these Inquisit Health is a lot of these mentors are Alaskans, and some of them are program graduates themselves. So they've gone through the program. They know exactly what what a participant's dealing with and can relate. So this program launched, it's through a partnership that the state has with the National Association of Chronic Disease Directors. And we launched it in August 2018. And since then, we've had 144 Alaskans enroll in the program. And you can see we've had people enroll across the state. We've got 40 people in the interior, 2 in the Southwest, 7 in the Matsu Borough, 23 in the Anchorage municipality, 55 on the Gulf Coast, and 4 in the Southeast. Now, Omada Health is that other free statewide national diabetes prevention program. This is again available to all eligible Alaska adults. It's delivered online though, so participants are placed in online peer groups that have weekly interactive lessons. and they're paired with trained coaches who can give them that one-on-one support and guidance that they might need. Participants in this program also receive a free wireless scale to help them track their weight. To determine eligibility, potential participants can click on that link and it'll take them through a risk screener to see if they're eligible. You can access this link through the slide deck, or it's available on our website too, and I'll show you where that's at in a little bit here. So once you click on that link, you'll see a little button there that says join for $0. And if you click that, it'll take you to that 1-minute risk screener where it asks you many of those same questions that were on the CDC's prediabetes risk test about your sex, ethnicity, your age, height and weight, family history of type 2 diabetes, other health conditions, and your frequency of exercise. And if based on how you answer those questions, it'll tell you whether or not you're at higher risk. And if you are, then there will be an option to click Apply Now. Once you click that, it'll ask you a series of additional health-related questions to confirm your eligibility. And then you'll receive an email from Omada with instructions to complete the registration. They'll ask for your address so they can mail you a wireless scale. And they'll schedule an official kickoff date for your introduction to the program. So this program launched through a partnership with the state in January of 2020, so just over a year ago. And since then, we've had 239 Alaskans enroll in the program. And among those, they've already lost over 1,600 pounds. I've included a little bit of data here so you can see a breakdown of participants based on ethnicity and compared to the percent of the Alaska population. So you can see that 74% of Omada participants are white, whereas only 65% of the Alaska population is white. So the whites are a little overrepresented here, and you can look at that throughout the different ethnicity groups. Black or African American is pretty on par with the Alaska population. Alaska Natives are a little underrepresented here, as well as Asian and Hispanics. So we have a little more work to do to try to reach out to some of those minority groups and let them know about this program. And you can see participants are enrolling from all across the state. Again, we've got 29 in the interior, 24 in the northern region, 15 in the Mat-Su Borough, 68 in the municipality of Anchorage, 51 in the Gulf Coast, 4 in the Southwest, and 24 in the Southeast. If you're interested, if you work at a clinic or a community-based organization that you'd like to help us try to promote these programs, we have flyers available for both the Inquisit Health and the Omada Health program. Just let me know and I'd be happy to put together a box to send out to you. We would appreciate anyone helping us spread the word about these programs. So for more information, you can visit our website at diabetes.alaska.gov. And on there, we also have a list of all of the national diabetes prevention programs available in Alaska, including those in-person programs. And we did a recording or a webinar back in May of 2020 with a doctor from Omada Health that went into a little more detail about the program and kind of showed you a little bit more about how it works. So if you're interested in looking at that, we have a recording of that webinar available on our website too. So when you go to our website, diabetes.alaska.gov, this is kind of what it'll look like on the home page. So if you see that green arrow, it points to diabetes prevention programs. If you click that, that's where you'll find the list of all the national diabetes prevention programs available in Alaska. And right above that, that big teal box that says, could you have prediabetes? That'll take you straight to the CDC's prediabetes risk test. So you can take that either online or you can download a PDF copy and print it to have those prediabetes risk tests available in your waiting rooms or at any health fairs you go to or anything like that. So that just kind of gives you a little overview of where to find these things on our website. We're also trying to get the word out through some messages that we have online. So this is an example of one of the messages that we have running this year. It says if you have prediabetes, you can still prevent type 2 diabetes. You can make changes and reverse prediabetes. Join a diabetes prevention program to prevent or delay getting diabetes. Meet with a trained lifestyle coach to learn new skills. Work together to help you feel better and improve your overall health. And click here to find a diabetes prevention program near you. And then people that click on that will be taken to the diabetes.alaska.gov where they have the list of the diabetes prevention programs available in Alaska. We are also using social media to try to get the word out. So we do social media posts through the Alaska Health and Social Services page throughout the year. Here's an example of one of the posts. This one was posted July 15th of 2020. It says people with prediabetes can significantly lower their chances of developing type 2 diabetes by losing 5 to 7% of their body weight and getting at least 30 minutes of physical activity every day. That means a person weighing 200 pounds would lose only 10 to 14 pounds. The Diabetes Prevention Program at Ketchikan Indian Community can help. And then we have a phone number there where you can contact them directly, or you can click the link to go to our website for more information. So we have posts throughout the year promoting all the different national diabetes prevention programs available in Alaska. This one here is promoting the YMCA and the Anchorage Neighborhood Health Center's diabetes prevention programs. This one is promoting the Inquisit Health program and telling people they can text health to 600-400 to see if they're eligible. And this one here is encouraging folks to take the prediabetes risk test and telling them that 1 out of 3 adults has prediabetes. A lot of people don't know that and they find it pretty shocking. So this ad usually has a pretty high click rate because people, they see that 1 out of 3 and are really caught off guard and want to learn more about it. And then this ad here is promoting the UAF Cooperative Extension Services Diabetes Prevention Program in Fairbanks. And here's an example of one promoting the Omada Health program, the online program. So if you see these ads and you're interested, you want to help spread the word, you can, again, we post these throughout the year. We usually have a diabetes post go out through Alaska Health and Social Services Facebook page about every week and a half or so. So you can check back there and like that page and keep your eye out to see, look for those diabetes posts and share them on your own page, or if you work for an organization that might be interested in sharing these, you can just click that little share button, like our posts, and help us get those, spread the word out. And that's really all I had for you today. I know that was kind of a lot of information, and I hope there might be some questions. Feel free to put them in the chat or raise your hand and we can unmute you.
All right, thanks, Mary. There are a few questions already waiting, so we'll just get started with those and then we'll go from there. So the first question is, can you address the use of low carb diets for regulation of blood sugar control?
I'm sorry to take a cop-out response, but I am not a healthcare provider. I am not a registered dietitian, so I would not be in a place to answer a question. That's something that you would really want to talk to your doctor or a registered dietitian about. Or if you participated in a diabetes prevention program, the lifestyle coach would be able to give advice on those types of things. But me personally, I'm not in a place to give medical advice.
Thank you. So the next two are comments rather than questions, but the first is saying that the program reduced risk by 71% in the individuals older than 60 years. And
yes, that's a really good point to make. That person is referring to, I'll go back to that slide really quick. So the study showed that there's a 58% reduction in development of type 2 diabetes among those that participate in the program like this. And that what that person is saying is for those that are age 60 and older, the results are even greater. They see a, 70% reduction in those 60 and older that participate in this program. So a really big benefit for those that are age 60 and older. Thanks.
Yay, we love to hear it. And then the second comment is saying that UAF is offering the program by Zoom from Fairbanks, Palmer and Wasilla, and Sitka as well.
Great, a little plug there. Yeah, I know UAF Cooperative Extension, they're getting ready to start a new cohort, so throwing in a little plug for their program there. And like she said, they're doing it over Zoom right now in light of COVID, so anybody statewide can participate in those programs. And if you want more information, if you go to diabetes.alaska.gov and click on that diabetes prevention program on the left-hand side, you'll find contact information for how to reach out to them if you have questions.
Perfect. And then another question is, does the state of Alaska provide coaching to diabetics type 1 or type 2?
In the state's diabetes prevention and control program, we do not work directly with individuals. We work more with health systems and community-based organizations to help them deliver these evidence-based services, and those would be the ones that people with diabetes would reach out to. So you could reach out to your healthcare provider or try to get some time scheduled with a registered dietitian. But the state does not provide those services directly, at least not in my program.
Thank you. And then I think this is the last question, but feel free, I think we have a little bit of time left, so feel free to continue to ask questions, but where to find a recording of this presentation?
Yeah, so I believe Anne said that anyone that registered for this will receive a link to the recording after it's posted around a week or two later. Anne, do you want to add anything to that?
Yeah, thanks, Mary. After we do these webinars, we're recording it right now, and we also have Mary's slides that she shared. We put both the recording and the slides on our webinar's website, and I will put that in the chat box here in a second. But everybody who registered for this, we will send a follow-up email to those registrants, whether they attended today or not, and we'll let them know that that information is online. So I would, based on past experience, it takes about a week or two to get that online. Thanks.
Thanks, Anne.
Thanks, guys. Ooh, one more plug we got. People can look for the Diabetes Self-Management Program, also offered by Zoom through Cooperative Extension at UAF. It's not individual counseling, but very helpful.
Great, yeah, lots of plugs for UAF on here today. UAF does some great stuff, so definitely reach out to them if you're interested in learning more about what they've got going on.
And I see Anne just put that link in the chat box, so hopefully you guys can follow that for the recordings of the presentations. But that's all the questions I'm seeing at the moment.
All right, and I will go ahead and, well, actually it's on the last slide. I'll go back to my last slide so that if you think of questions later, you can jot down my email address and get a hold of me later. So there it is right there, mary.schneider@alaska.gov. Feel free to reach out if you have any questions. If you're interested in starting a diabetes prevention program, or you want to learn more about some of the programs I mentioned, or you want to know who to get a hold of for something, reach out to me and I will connect you with the right person, or I can talk to you more about how to establish your own diabetes prevention program.
Great. Thank you very much, Mary. I'm not seeing any more questions unless another one came in. Megan, do you see any more questions?
I do not.
Okay. Well, thank you again. And like I said, we will send registrants a follow-up email with the links when they are live, but also please, you're welcome to keep checking that webinar website that I put in the chat box. And thank you, Mary, for your time today. And thank you, everybody, for attending. That concludes today's webinar.
Thanks.
Thank you.